Trick or treat, whichever you do, just make sure you do it safely. Here is Dr. Jenny Valencia from Palmetto General Hospital with safety tips for your kids this Halloween. Dr. Valencia, it is awesome to have you on the show. Welcome.
Thank you, Dave, for having me.
Are you excited for Halloween?
Oh, very much, very much.
Yeah, you're telling me your daughter's going to be a superhero?
Oh yeah, she's going to be the girl version of Captain America.
Good, and you are going to be, who knows? Still working on the costume?
Yeah, a little bit.
Yeah, just wear that. Now, you're a doctor. Cool costume, built in. Yeah. All right, so we're talking about Halloween safety for kids, and we have a bunch of things to get to. Let's start with making sure your kids can see, which I guess is pretty important.
Well, that's actually very important, Dave, because if they're not seeing where they're walking, they're going to fall, they're going to be tripping over.
Right.
So it's important, if they have a mask, to make sure the eyes are wide open, or you can cut just extra space so they can have a good visual field, or use non-toxic face painting. That
Okay.
could be.
Yeah. Do you ever, working in the emergency room, do you get a lot of Halloween-related kids injuries? Kids that come in?
Well, we do get allergic reactions to the face painting.
Okay.
We get, unfortunately, some people use candy that are not
Right. Okay,
safe candy.
So let's jump right to that, because that's on this list too.
Yeah.
And I remember when I was a kid, that was the biggest fear, right?
Yeah.
When I was a kid, we'd come home and we'd open every piece of chocolate and we'd look at it, right? So you advise doing all of that.
Yes, and especially tossing away anything that is not on the original wrapper. Any candy that has been, open or is not well closed, you have to throw it away. Any homemade candies, please. This is very important. A lot of people are using toxic things into the candy or into the foods they're distributing to the children, even drugs.
Wow.
So we have to be careful.
It's so sad that we even have to have this conversation.
It's not very common, but when it happens, it's one is too many.
Sure, of course. I know in reading the notes, and one of the things that you might offer as a solution would be eating healthier anyway on Halloween, right? Like if you're going to make treats for other people at your home, maybe fruits and vegetables or things like that.
Exactly. It works very well if you're having a Halloween party at your home.
Yeah.
But it doesn't work very well if you're having like trick-or-treaters, because they don't know you, so they're not going to eat them anyway.
Right. I would be pretty mad if I got broccoli as a trick-or-treater. I'm not going to lie to you. I would be at someone's house.
Your home wouldn't be very popular.
Yeah, someone's house would be getting toilet paper or egged for sure. Yeah. Well, good luck with that. All right. Something else we have on here is wear something that reflects light.
Oh yeah,
Right.
that's very important.
Yeah.
There's a lot of accidents due to, with cars or bicycles or motorcycles, and pedestrians get run over. So we have to, first of all, if we can, use some reflective tape, or just give the kids flashlights. And you have a flashlight of your own as well.
Right.
So everybody can see them as they're walking.
What about these kids traveling by themselves? You said your daughter was 7, right?
Yeah.
What is the age? What is the appropriate age where kids can go off by themselves or not?
I guess adolescents
35?
can go more or less.
Yeah.
No, I mean once they're like in their teen years, and if you know your child is a responsible child, you know who they're going with, you know the path they're gonna be walking. You more or less know where they're gonna be. That's okay. But it's not advisable to let little kids or even older children live by themselves. Sometimes we tell the adolescent older brothers to take care of the little ones, and this is not fair. They're adolescents, they're still children, so they're trying to take care of themselves. It's more difficult if we tell them, okay, take care of your little one. They cannot be responsible for 2. So my advice in that case would be you take, as a parent, you take care of the little one. And well, adolescents like to go on their own.
That's great. I'm all about it. But I think then the parent needs to dress up. If you are going to be taking your daughter in her cool superhero costume out, you're going to have to wear some sort of costume.
There's always something you can wear. Make it fun and happy and to make it a memorable day.
The lame parent that just walks around with no costume. That's no fun. This was an interesting one I saw. Pumpkin carving and what kids can do, because obviously you're thinking about sharp knives and stuff. You don't want your kids doing that. But there are roles that kids can play in the pumpkin carving.
Absolutely. They can do the drawing, and you can just carve it for them. But they can take care of the drawing. That's a safe. Nobody will get hurt.
Right. And then sort of on that same vein is the jack-o'-lanterns, that maybe instead of having a candle in it, you can use like sort of like electric lights or things like that, right?
Electric lights or even the glow-in-the-dark sticks. These are very easy to use and they're risk-free, basically. If you have little children, be careful with those little candles, the fake candles, the lights, because they have button batteries. And these button batteries are very dangerous. Once they get a hold of them and they swallow them, they perforate the membranes.
Okay.
I've seen them inside noses or swallowed, and it's never a good picture.
Ooh,
yeah.
Man. Okay, that's good.
Yeah.
That's a good one to know. One thing I remember we did a story on a couple years ago was these colored contact lenses.
Yes.
And those are really bad too, or they can be, right?
Well, anybody who's thinking about using them, and that's a very important topic, which nobody really talks about,
right.
They should go to the ophthalmologist to have a prescription for these costume lenses. But they shouldn't buy the ones just on the market.
How come? What's the danger? Could you like
infections,
lose your eyesight? Okay.
Infections.
Right.
Because you have lacerations or ulcerations. Basically, it's abrasion of the cornea. So eyes are very important. They're very easy to harm. So we shouldn't use these lenses that are not prescribed. They should have a prescription by an ophthalmologist, and then those will be safe. And always follow the directions, of hygiene with them, and not to take them out with your dirty hands. I mean, obvious things that are good to. We need to remind you the children.
Kids' hands are always dirty. Right?
Yes, but for children, for little ones, it's not advisable. If teenagers want to use them, they should get a prescription anyway.
One more that I thought, you say it out loud first and you're like, obviously that's common sense, but don't go inside a house to accept candy. Again, it sounds like common sense, but I feel like maybe that's something that doesn't get said enough to kids when they go out. Yeah.
Very good point.
It's
never good. It's never good to enter a home you don't know. Only if you know the people very well, and even so, with an adult.
Sure.
Never alone.
Right.
Never alone. Children should not be alone.
Well, thank you so much for coming by, Dr.
My
Valencia.
pleasure, Dave.
And keep us posted as to what you end up wearing for Halloween.
All right, I'll let you know.
Okay, and then come back again soon. Okay.
Sure.
Okay.
Thank you.
Thank you.
Thank you.
All right.